Hello everyone, it's Dr. Dave. Hopefully you're all doing well. You had a nice weekend. Looking forward to your week ahead. I hope it's a healthy one for all of you. Coming at you on behalf of the Toronto Neck and Back Pain Clinic with your daily health update. It's Monday, June 21st, 2021. Going to look at 6 areas of health and wellness today. Somewhere around this video, you can read through all 6 areas. If you have any questions or you'd like a copy, you can DM us on social, give us a call here at the clinic, or send us an email and we'll be sure to help you out. Not going to treat, diagnose, prevent, or cure any illness or disease with our time together today. However, by starting this process today, maybe it might be your first time daily health update, or maybe you're plugging back in after a while. You just never know what you can do and what your body's capable of when you give it some good information on a daily basis. It'll influence your own thoughts, decisions, and actions when it comes to your health and wellness. And that's what we want, to keep that health and wellness on the forefront of our mind. So good for you for being here. Thanks for joining me. Always a pleasure. The European Heart Journal looked at disrupted sleep and how that can present some health risks in April of this year, 2021. An analysis of 11 years of data concerning over 8,000 adults revealed an association between sleep disorders and poor cardiovascular health, especially in women. So these are these concomitant or concurrent health conditions where one aspect of our health plays into or feeds into the other. And that's a plus. So when you do a good thing for yourself, it probably has some ramifications on your overall self and other parts of you. But also when an area is not getting addressed or met, or there are challenges, it can have a spin-off or spiral effect onto the other parts in the other direction as well. So it works in our favor, but it can also work against us. So those fundamentals we talk about, sleep, nutrition, and activity, if you have them in your life, there's a lot of positive side effects. And when you don't, there can be a lot of negative side effects. So trying to get good quality sleep, non-disrupted sleep, is very valuable. The JNCI Cancer Spectrum, a report from March 2020, looked at diet being important for long-term survival in breast cancer patients. Among a group of over 3,500 female breast cancer patients, researchers observed that a healthy eating pattern, such as the Mediterranean diet or the DASH diet, was associated with up to a 27% reduced risk of death during the following decade. So here, even with a health challenge, in order to fully recover and have the best outcome, we come back to our fundamentals, one of them being nutrition, and being sure that our body's getting the nutrients it needs to take care of itself and to heal and to stay healthy is very valuable. The Journal of Aging and Physical Activity, April 2021, looked at age not being a barrier and shouldn't be a barrier for people to keep fit. According to researchers, the belief that it takes longer for muscles to recover from working out as you age is based on little, if any, evidence. In fact, the researchers note that more than half of the available studies have noted that older males experience similar and even less severe symptoms of muscle damage than their younger counterparts. So it is an individual experience, though not everybody likes to work out. It's not our favorite thing to do. It's better to find an activity that we enjoy to help keep ourselves healthy. But if that doesn't exist, which it may not for many, then we want to try and include activity of some kind in our lives to take care of ourselves. And it is an effort sometimes, but that time that it takes us to do it over time and how we recover from it over time is not a reason to do it or not to do it. We still want to keep doing it. But here it even says that those concepts may not be accurate, and as we get older, we may benefit the same and not have any increased challenge simply because of age. So good to stay active is the bottom line for sure. Traumatic brain injury increases the risk for stroke, according to the International Journal of Stroke, April 2021. They looked at 18 studies and they found that traumatic brain injury can elevate an individual's risk for stroke over the following 5 years by up to 86%. So if you've had a concussion, have been knocked unconscious, or had another form of traumatic brain injury, you do want to talk to your doctor about monitoring for any side effects over the coming months and years from having had that incident. It's good to recover, but it may have some deeper and longer reaching effects over time that you want to be cautious of. And again, increase your ability to take good care of yourself even once those symptoms are gone or you've recovered, so that you can mitigate or negate the potential side effects of having suffered whatever that trauma may have been. All right. PIH Health, April 2021, shares some tips on how to prevent athlete's foot. If you've noticed some constant burning or itching between those toes, it could be athlete's foot. So to fight that common fungal infection, you want to keep your feet dry, wash your feet daily, wear shower shoes or flip-flops, and use a foot powder when appropriate. Take good care of those feet. You're going to use them for a lifetime for sure. The BMC Musculoskeletal Disorders note from April 2021 talks about excessive screen time use and spinal pain in children or kids. Using data from the Danish National Birth Cohort concerning over 45,000 pre-adolescents, researchers report that kids who spend 6 or more hours per day using electronic devices are 2 times more likely to experience severe spinal pain than their more active peers. These findings suggest that reducing screen time and increasing physical activity levels in children may protect them from spinal pain during childhood, and getting them in those habits and controlling what they do, how they do it with those electronic gadgets, improving the ergonomics perhaps, but then also limiting or allowing for appropriate time usage, because it's not all bad, but also to create an incentive or encourage the habit of being active instead of being on those devices is a good choice as well. Setting that habit early will help somebody, say, if they end up working on a computer on a daily basis, which many of us do, but to do it well, but then also to take the breaks and stay active to help negate the effects of some of that sedentary repetitive work or use. All right, so that's your daily health update for Monday. It was a pretty good one. Hopefully you enjoyed it. Enjoy the rest of your week as well. Take good care of yourself. We'll be back tomorrow with another video daily health update for you, and we'll look forward to chatting with you then. Take care.